So in this class, we will see the inguinal ligament. It's a important short notes in the abdomen region. So this inguinal ligament we have already seen in the anterior abdominal wall muscles and also in the inguinal canal class. So the little more details of the inguinal ligament we will see in this inguinal ligament. It is the thickened lower border of the aponeurosis of external oblique muscle. Are you seeing in this image aponeurosis of the external oblique muscle, which is the first muscle in the anterior abdominal wall, superficial. So this aponeurosis is thickened in the lower part and it is folded backwards, presenting a grooved upper surface. So that is the inguinal ligament. Its other name is Paupart's ligaments. Pouparts, Paupart's ligament. If you see its length, it measures about 12 to 4 centimeter length in the adult. So have you seen the inguinal ligament in this image, which is the lower border of the thickened aponeurosis of the external oblique muscle. So again in this image you try to see the lowermost two arrows. It is marked as IL. It is visible as a short, it is visible as a glistening ligament in the lower part. So that is the aponeurosis of the external oblique, which is thickened in the lower part and it is folded backwards to form the inguinal ligament. If you see its attachments, it extends laterally from the anterior superior iliac spine to the pubic tubercle medially. So that is the attachments of the inguinal ligament. So this image shows the inguinal ligament which has a grooved upper surface. So this is that grooved upper surface of the inguinal ligament, and also in this image you can see the attachments clearly attached laterally to the anterior superior iliac spine and medially to the pubic tubercle, which was not shown clearly in the last slide. You can see in this slide the attachments of the inguinal ligament clearly, and it has a grooved upper surface. It forms this grooved upper surface we have seen in the floor of the inguinal canal. Now next is the expansions of this ligament or the modifications of this ligament. If you try to see the medialmost end of the inguinal ligament in the picture, you will see three expansions: lacunar ligament, reflected part of the inguinal ligament, and pectineal ligament of the Cooper. So in this you can see clearly lacunar ligament. First we will see the lacunar ligament, or the other name is Gimbernaut's ligament. Gimbernats. Gimbernaut's ligament. You try to see that medialmost end of the inguinal ligament, which is having small another modification, that is the lacunar ligament. It is triangular in shape. It extends backwards and upwards from the inguinal ligament, and it is attached to the medial part of the pecten pubis. You can see clearly from the inguinal ligament it is attached to the pecten pubis. That's the border of the superior ramus of the pubis. So if you see this triangle, its apex is formed by the pubic tubercle and base is free. This base you should have learnt in the femoral ring. This base only forms the medial border of the femoral ring in the femoral sheath. So this is the one expansion, that is the lacunar ligament. Another expansions you can see in this reflected part of the inguinal ligament. Are you seeing in the second lowermost arrow on the left side? That is the reflected part of the inguinal ligament, and the lacunar ligament is seen. What is this reflected? A few fibers from the crura, inferior crura, that is attached to the pubic tubercle, that is the inferior crura. A few fibers from this crura, inferior crura of superficial inguinal ring, are reflected upwards and medially from the pubic tubercle. So that is the in front of conjoint tendon. So inferior crura attached to the pubic tubercle reflected backwards in front of the conjoint reflected upwards in front of the conjoint tendon, and it is inserted in the middle to the linea alba, where they interlace with the fibers of the opposite side. So that is the reflected part of the inguinal ligament. This may be also called as the third crura of the superficial inguinal ring. The third modification is the pectineal ligament or the Cooper's ligament. Pectineal ligament or Cooper's ligament it is not shown clearly in this image. It is just now we have learnt the lacunar ligament, where it is attached, lacunar ligament from the, again you see the lacunar ligament from the base of the lacunar ligament. So the base, now only we told it forms the medial boundary of the femoral ring. From the base of the lacunar ligament, a fibrous band extends laterally and attached to the rest of the pecten pubis. So that is the Cooper's ligament or pectineal ligament. So why this is called as Cooper's ligament is, the scientist Astley Cooper suggested the importance of this ligament so that it can be used in the repair of the inguinal hernia. So that's why it is called Cooper's ligament. So we have seen in detail about the inguinal ligament, which is also called as the Paupart's ligament, which is attached from the anterior superior iliac spine to the pubic tubercle, and it has three modifications which we have seen. Lacunar ligament, also called as Gimbernard's ligament. Second is the reflected part of the inguinal ligament, which is also called as third crura of the superficial inguinal ring. Third is the pectineal ligament, or also called as the Cooper's ligament. So you can prepare this inguinal ligament as the short notes for your exams.